10 a.m. and so we will get started in just a moment as folks continue to join. Thanks so much for being here, and we'll get started in just a moment.
And just to let you guys know, we will be recording this, so I'll be sure to send the link to Kristen and Samara so they can share it with the group. Sound good?
Perfect.
Cool.
Tiffany, Kristen, this is Kay Dunkley at the Roanoke Higher Education Center. Can you hear me?
We sure.
Yes.
Mm-hmm.
Okay.
Kristen Adkins. I'm the Population Health Manager for the Roanoke City and Allegheny Health Districts. We are very excited to be continuing on this effort that we started a few weeks ago of pulling together the Roanoke City, Allegheny, and New River Health Districts to really think about maintaining a regional approach to messages about the COVID vaccine. We know that the vaccine is a real game changer in the message that we've been pushing about COVID for a while. But I did want to take a moment and remind folks before we get into it that our cases are very, very high. And I know that we've been saying that really since September, but they continue to climb. And that is very concerning. So I just wanted to remind folks that we are not out of the woods. And that the prevention messages that we've all been pushing are still important while we prepare for a vaccine. We are seeing the post-Thanksgiving cases continue to rise. And so just wanted to remind folks that we're still very much in it. That being said, this is a really important way for us to have a really refreshed message as we bring to the community. So again, thank you for being here. What we would like to do, since we have so many folks, instead of introductions around the room like we normally would be to use the chat box again, and that helps us with capturing who is with us today. So if you would utilize that to let us know that you're here and your agency and your coverage area, that would be perfect. And that really helped us last time, like we said, capture all that information. So again, glad that you're here. Appreciate your commitment to this cause. And if you would introduce yourself in the chat box, that'd be great. Special thanks to the City of Roanoke for hosting us on Zoom this morning, and Tiffany. And we will be recording this meeting and sending it out for anyone who can't join us. So again, we have some exciting things planned for our agenda today. We will be able to share some information with you from the state campaign. We will be able to share with you some of the feedback that has occurred in focus groups in the New River Valley, which is very insightful as we try to think about how we message this in a way that addresses what we know is a very real hesitancy around the vaccine. We will also like to get an update from Robert Parker, our regional public information officer for the health district, and the what's been happening with the New River Valley Task Force, since that's been a regional effort already. And then we'd like to move into some strategies moving forward, and we'll have some conversation about that and fill out some kind of concrete ways that we can all partner together. And then we'll address next steps moving into the new year. So really very glad that we have some folks from the state joining us today, and some feedback coming out of the New River. So that'll be very helpful as we kind of gauge where we are starting from. So what I'd like to start off the agenda with is introducing Todd Fouts. Todd is with Siddall Communications, who has been working with VDH to develop the statewide information, and he will share some slides with us and some background about how their effort has unfolded, which we really appreciate the commitment that they've had to doing this right. We've had some insight on that, but we wanted you all to have that as well. So Todd, I'll turn it over to you, and thanks so much for being with us.
Yeah, thank you very much, Kristen, and good morning, everybody. I see some familiar faces and some familiar names on the screen, so it's nice to see you all again. I'm going to share my screen if I'm able to do so. Yep. And this a little larger. So everyone can see my screen okay? All right, thank you. So I wanted to give you a little bit of an update on some things that have been we've been working on in regards to the vaccine communications. Just as an overview of our strategy, you know, we have many of you have probably seen that this is going to roll out over a series of phases. We've actually looked at those phases and carved them up into a strategy of crawl, walk, and run. We look at these first two phases of the vaccine rollout, where the vaccine is coming and the vaccine is arriving, as kind of our crawl phase. There's some fundamental communications efforts that need to take place there. And then as the vaccine becomes more widely available and in greater supply, our strategies will evolve and change as we go into next year. Moving on. So our objectives for this initial phase is primarily two focused. One is to educate and inform people. The other is to build trust. You know, we want to be able to address a lot of the concerns. There's a lot of misinformation out there in the marketplace about the vaccine, and we want to establish VDH as a source of truth for that information and be able to drive people to the website for additional information and details about the vaccine. We also want to build trust by opening up channels of communication and having a two-way dialogue. And there's a lot that's been going on in the state over the last week or so, and we'll see continue over the next several weeks to be transparent and keep the public informed about what's going on. I wanted to recap on some things that we've been working on over the last week or so. One of the things that we had out in the field recently was a survey of all the local health districts across the Commonwealth and all of the PIOs as well who have been involved in this. And we got some terrific feedback. Some of the big takeaways that we learned out of that survey is, you know, a lot of information is shared in emails or many times lost in emails. There are multiple sources that people have to go to for information and tools. Really be great to have a single source of information for those tools. More context and calls to action on, you know, what's needed and best practices. So we've taken all of this and we're going to be developing what we're calling a COVID communications hub. This will be actually a resource for local health districts across the Commonwealth and PIOs to use, where they can go and find toolbox materials, videos, shareable social media assets, presentations, campaign materials, things like that. It'll basically be set up almost like a wiki. It's not going to house any information, but it's going to point you to the correct information. So we're going to create this site that's going to be an organized, clear sense of navigation for folks to be able to find the information that they need. This is going to be something actually that we're taking live next week. Initially, it's going to include the vaccine communication toolkits and information, which is in a very hot demand right now. We'll also be adding the mitigation and containment toolkits and resources. And then our plan is to evolve this in time over the coming weeks to include best practices. You know, we often hear from local health districts who, let's say, have a great communications outreach program for faith leaders. We want to be able to package that information and share it so that other health districts can use that and apply it in their own communities. So there will be a best practices section of this as it evolves as well. So we're super, super excited about it. It's something that's going to be rolling out next week, and it will continue to evolve over the coming weeks. The vaccine webpage is now live. We did some redesign on this page to try to bring some more clarity to it. The initial vaccine page had a lot of information on the site, and we just applied some best practices to bring the most relevant information up to the top of the page and push a lot of the details down below the fold, but be able to direct people to the right information. So if you haven't been to the site, it's updated almost hourly, it seems, by the folks at VDH. It's vdh.virginia.gov/COVID-19-vaccine. And on there, you'll find the frequently asked questions, which is a very extensive list of questions. And again, those will be updated on a very regular basis. Initially came out with a flyer about the vaccine, how will we get an effective vaccine? Actually, we have several that is available now in English and translated versions. Same with a social media shareable about the vaccine. These are available now. There's going to be many more shareables that are going to be coming beginning next week and into the following weeks. There are a couple of fact sheets that we're developing. There are two now that are up on the site. One is about the development of the vaccine. Again, that's available in translated versions as well if you need those. And there's one on safety as well. These would be like the types of tools that would be found on the Communications Hub when you go there next week. There's also a lot of additional fact sheets that are going to be coming. I think we've got about a dozen that are in various stages of review and approval with VDH at this point in time. So they cover a wide range of questions and issues about the vaccine. So we're excited to be able to push those out on the website and in the Communications Hub. And then we're taking information and key facts from each of those fact sheets and developing shareables and presentation graphics for those as well. So those will be coming beginning next week and into the following weeks. I saw the presentation template was being used as this meeting opened, so really excited about that. We do have these templates available, and we're hoping to provide actually some additional ones shortly after the first of the year. Give you an update on some PR and community relations activities. Hopefully many of you got to see on Wednesday night, there was a town hall that was broadcast in media outlets across Virginia. It was here in the Roanoke area as well. It was a great feedback that we got from this panel with Dr. Oliver, Dr. Hilton, Dr. Seafree, Dr. Gibson, and then we had Marvin Figueroa. Unfortunately, Dr. Vargas Jackson was not available, but Deputy Secretary of Health and Human Services, Marvin Figueroa, joined at the last minute and did a great job. This is available now on the WRIC Richmond Station's website, and that address is at the top of the screen here. It will be put up on the VDH website later today. We're just waiting to get a link on that this morning, and that will be posted. There will also be a Spanish version of this available as well, and we're hoping to get that later today too, to be able to share. But it was a great town hall. Hopefully many of you got a chance to see that. And then actually taking place today, we have the commissioner for VDH is lined up for, I think we've got like 24, 25 interviews set up for him all this morning, heading into early afternoon with media outlets across the country. He's going to be talking about the distribution and rollout of the vaccine. So we've got an opportunity to get tremendous coverage out of that. We're very excited about it. Happening at the same time today is we have a Spanish media tour as well, again with Deputy Secretary Figueroa, who will be meeting with Spanish media outlets across the Commonwealth, including Telemundo, Univision, a number of Spanish radio stations, and some online media outlets as well. So between the town hall and the satellite media tour that's taking place today, we've gotten tens of thousands of eyes that are on the messaging about the vaccine. There will be more town halls that you'll be hearing about as we head into 2021. It's an effective way for us to get the communication out, and we've got great partnership from media outlets across the Commonwealth. Coming up, just some things that we're working on. We do have a pretty large research initiative, both a qualitative and quantitative study that's going to be kicking off in January. We've got focus groups, virtual focus groups that we're doing with providers across the Commonwealth, community leaders, as well as local health district leaders. We're also going to be doing a benchmark study, a quantitative study across the Commonwealth, and that will be rolling out in phases throughout 2021. So we'll be able to have some really great information. There are also a number of listening tours that are set up with various communities across the Commonwealth, with Black and Brown communities, the Asian community, Latinx communities. So we're collecting information from a lot of these communities. We're also finding key messengers in these communities to be able to help deliver the message about the vaccine to those communities. There will be a toolkit that's in development actually for provider communications. That's work that's being developed by the Vaccine Advisory Work Group, and we're assisting them in that. We're going to be creating also a series of videos of provider to provider communication to be able to talk about the vaccine. We have public facing video that's going to be into production early in January, featuring providers across the Commonwealth who are talking to the public about concerns about the vaccine, talking about the development and safety of it, and also saying why they're taking the vaccine. That will be the beginning of several public-facing videos where we'll have initially medical professionals delivering that message, and then faith leaders, community leaders, others that will be doing those additional videos. And then we have a number of op-eds that are being developed. It says 4 here. Actually, I think there's probably twice as many at this point in time that are being developed that are going to be authored by folks across the Commonwealth. And we're setting up those right now. And hopefully the first ones will be happening in early January. So that's my update for now. Be happy to take any questions or recap anything that we've been working on and share that with you if you'd like.
Thank you, Todd. It is really refreshing to see all the work that goes on to bring these messages to our communities. And so I really appreciate all that's going on. It's nice to see how it comes together. And I see a suggestion in the chat box about engaging with faith communities. Did I catch that, Todd, or are there any plans to reach out to faith communities?
We have a couple of things planned. One is we are going to be doing some listening tours where we're going to be reaching out to faith leaders to be able to see what the concerns are in their communities, and also seeing if there are key messengers who can work with us to deliver those messages to their communities. We're also planning to take that information and develop some specialized communication tools, specifically a video, but there might be additional tools that we would create.
Thank you. Any other questions for Todd? And if we don't get to them now, please add them to the chat box and we'll try to keep an eye on that. But anything you can think of now?
This is Bobby. I'd heard one of Todd's colleagues say, and I think, Todd, you mentioned the in the Data Hub, the best practices section and sharing good tools with that. And it was described, I think, very eloquently by one of your colleagues as being a location for bottom-up insights rather than top-down tools. And I say that because the people on this call are the ones that know best what works where you are and in your communities. And I also say that to encourage you to share with that hub. It will be all the more useful if those that can contribute do so. So please keep that in mind.
Thank you, Bobby.
Thank you. We appreciate that update, and this team is assembled with the purpose of being prepared and ready to share that out, those resources as far and as wide as we can in our locality. So we appreciate that update, and we are poised and ready to be able to share and amplify as best we can through our channels. And I see some compliments in the chat box and some reiteration that we are ready for that. So thank you. Please keep those questions coming. Todd, if you can stay with us, we'll pass them along as I see them. And if not, we'll just stay in touch with you directly to try to get those answered. What we'd like to do now, we had some focus groups done at the local level, generally about COVID, but with some information about vaccine. And so Dr. Sophie Wenzel with Virginia Tech, Center for Public Health Practice and Research has those results to share with us, which gives us some insight about what folks may be feeling. And as Todd shared, the state has done that as well in the development of their campaign. And so we really appreciate the time that it takes for folks to check in with community about where they are before we plow forward with our messaging. And so we wanted to take advantage of having this local information. So Sophie, I'll turn it over to you, and I appreciate you doing this work and for sharing it with us.
Yeah, sure. Thanks for having me. So I'll make this quick. We conducted first of all, a survey from May to July looking at messaging, and that was throughout Virginia. And we had about 3,700 respondents for that. I'm happy to share those results with anyone. The point of this is for people to get what they need. So we are very happy to share those results. We also conducted some focus groups as part of a phase 2, July to September. Keep in mind that these are, it's focus groups, so it's small numbers, but hopefully there's some insight here that can be helpful to you all. And Kristen, this was actually throughout Virginia. We definitely had more people from New River because that's where we are. That's where recruiting was easier, but this is throughout Virginia. And we did conduct specific focus groups with the young adult population and with the Black African-American population, just because at the time that's where we were seeing some of the most need, and with the young adults with the transmission. Next slide, please. Thank you. So I'll make this brief. These were some of the trusted sources. This was a pretty intensive, probably an hour and a half each for the focus groups, conducted all online, of course, on Zoom. But they trusted local news, they trusted the governor's press conferences, they trusted different health organizations. And I just want to point out there that local health districts were mentioned by many of the focus group participants as a trusted source of healthcare messages. For Virginia Tech employees, they trusted their employer. They thought they were getting great messages from their employer. Specific people, Dr. Fauci, Governor Northam, were people that were trusted. And then information at the local government level was also a trusted source of information. So I think those of you on here that are from local governments would want to know that. Next slide, please. Some messages that were trusted, again, this is, 82 participants, but the wearing a mask to protect yourself and others, the need for distancing, the fact that COVID affects people of color more, especially the Latinx and African-American populations. And then I see a message come up, and I'm happy to answer that. I'll look at the chat box after. And then, this message that we've all heard since the beginning, which I think may still exist in people's minds, is that the older adults, especially those with pre-existing health conditions, are particularly impacted. Next slide, please. So some messages that people thought were missing or that were contradictory was the role of transmission, how it's transmitted, what are long-term effects, a lack of clear messaging on the importance of mask wearing. So people, they trusted the message that they should wear a mask, but they still got contradictory messages on masking. And then messaging on, can children get it? Can children spread it? What does that look like? That came up a lot. People just still not exactly sure what that looked like. And then, this is something that we've heard, and this is why we're all here today. Overall consistency in messaging was something that we heard throughout all the focus groups, just this confusion and the contradictory messaging, and really just wanting one voice to tell them what to do. Next slide, please. So a few messages from our young adult focus groups, and a lot of these were Virginia Tech students, but not all of them. From students, this concept of the messages seeming threatening, like here's what you shouldn't do. It wasn't so much in this context of, hey, here's what you can do safely, but it was like, don't do this, don't do this, don't do this, is how it came across to them. The concept of a pod, still unclear and constantly moving. So students talking about their pod, but then talking about their roommates that weren't in their pod, yet they lived with these roommates, or talking about hanging out with 3 or 4 people one night and then another crew another night, and they were in small pods, but it wasn't always the same people. So this moving pod. And then students needing to balance their mental health with distancing. So being willing to take the chance and hanging out with people because that's what they needed for their mental health. A message that we heard a lot from young adults was this willingness to stay safe if they were going to go see family or parents. So either getting tested before they went home or, you know, making sure that they quarantined before going to see their parents because they wanted to keep their family and parents safe. Public versus private behaviors when it came to mask wearing and distancing. So, you know, wearing a mask on campus, in class, at stores, but then the mask coming off when they were in private with friends or people that they quote unquote trusted or knew well. Pandemic fatigue, I think, is something that we've all heard and are all experiencing probably. And then the need for relatable stories. So like, tell me why this is important. Tell me about someone I know. Tell me about someone that relates to me. Don't just tell me, don't do this, but you know, really something that relates to them. Next slide, please. Some general thoughts on vaccines. So this study was more focused on messaging they were receiving, but we did add a few vaccine questions just because you know, we thought it would be important to know. Most of the people we talked to did plan on getting the vaccine. However, they wanted a better understanding of, you know, how is the vaccine going to work? What are side effects before receiving it? Several of our participants were like, you know, sign me up, I'll be the first in line. But a lot of them really wanted to wait and see like what's going to happen to other people first, and then I'll get it. A lot of people working from home said, you know, I'm comfortable taking a seat back, continuing to work from home, and I'll wait and make sure that the people that are on the front lines get it first. And then people were worried about that, you know, we've heard this, that the process was rushed and really not sure what long-term side effects would be. So a little bit hesitant because of the fast process. Next slide, please. Young adult view specifically on the vaccine. We heard a lot of the young adults say, you know, I've been vaccinated. This is kind of what I do. So I trust vaccines and I'll get one. They were willing to get it, but still there is, you know, again, with the general population, what are the long-term side effects? Just a little bit of nervousness. Again, this theme of prioritizing family members or parents. So they would rather have their high risk or, you know, older parents get it before they do, just because they wanted to prioritize them. They thought it was more important for them to get it. And then some of them did wonder, will it be required to start a job in the future? You know, those that are leaving college. Next slide, please. This is specifically from participants in the Black focus groups, and I was really happy to see, to hear Todd talk about their focus in their listening sessions, really focusing on the minoritized populations to get more of their input. So there was a general consensus in these focus groups that they would get it, but again, concerns. The safety due to the speed at which this was created. Are there any long-term side effects? We actually heard several people talk about, is the vaccine going to cover different strains, if there are different strains? You know, there may need to be some education around that. And then several people talked about the health literacy rate in the United States and specifically within this population. The need for education to, you know, what are some address concerns, decrease hesitation and confusion around vaccine uptake. And then one more slide. This is just a final slide with a quote, and I think this quote just really shows, you know, still some uncertainty, some hesitancy, some misinformation. Getting the vaccine is something I've been debating just because I feel like it's so rushed. Whenever there's a vaccine, it's only going to cover certain strains, just like the flu. You can get the flu vaccine and still possibly get the flu. In Corona, it's so new. I feel like they don't have all the strains, and if you get the vaccines, you can still get Corona, and you don't know the side effects. So just kind of to put all of that in perspective. That was a very quick overview. I'm going to pull up some of these comments that I'm seeing. Was there a separation between local and national news? Yeah, so we did actually, in the survey, we asked very detailed questions about local versus national news. Specifically in the focus groups, they talk about trusting local news, and Yeah, it could be that you take some of the national news and put it on the local channels, because I think there was this sense of trusting those the local people more than what they would have seen at the national level. Yeah. Yeah, so people are trusting their local governments. So hopefully the local governments can all get on board to share accurate and scientifically driven messages. Yeah, I'm happy to answer any questions. I'll put my email in the chat box if anyone is interested in looking at our overall survey results. We actually just did a study for the Appalachian Translational Research Network and had Appalachia specific data that we pulled out for that if anyone's interested in looking at that specifically. The whole point here is whatever messages we can share with you all that can help you and ultimately, reach the right population. So thank you for your time today. I appreciate it.
Thank you so much, Sophie. We appreciate, like I said, the time it takes, but the importance of really checking in and understanding what folks are thinking and feeling. And we know that there's a lot of hesitancy here, but it helps to really understand where various populations are and how we can address that. What I think could be the power of this group here is that because we do have so many folks across several regions, the Roanoke Valley, the New River Valley, Allegheny Highlands, we have so many specific populations within these communities. We have urban, we have rural, we have various ages, we have various ethnicities and races. One of the things that we've got to do is figure out how do we reach the folks, particularly who might be hesitant, but also who are somewhat unlikely to receive the information through our normal channels. And so we'll talk about that in a moment. But we appreciate you sharing that feedback, and we will keep that in mind as we move forward, thinking about what's going on in the back of people's minds as they approach this vaccine and COVID in general. We'd like to move into the next part of our agenda. Again, just keep those questions coming in the chat box and we will connect with these presenters if we don't get them answered while we're together. Bobby Parker is our PIO for the Virginia Department of Health, the Western region, which covers the health districts that we have, hi Bobby, brought together on this call. So we'd like to give Bobby the floor to talk about both what's coming out of VDH, but also the work of the New River Valley Task Force, because that has already been a regional effort and we certainly want to build on and recognize what's already been going on as we look to expand and do some work in the New River Valley, Roanoke City, and Allegheny. So Bobby, thank you for what you're going to share with us today. Thanks,
Kristen. And okay, you've got the slides. Great. Thank you for doing that. If I may share my screen, I might bounce back and forth. Well, actually, if I can share my screen, I'll just walk straight through the items that are in the slides. And then we'll see if we have any questions or if I've overlooked anything. Let's start with this. And actually, no, that's not what I wanted to share. Sorry. Still learning. That's it. And forgive the bluntness of this, but I saw a presentation on this student-run campaign at Boston University, and I heard Sophie mention relatable messaging, and this seemed to be exactly that. Some students have the opinion that proper behavior is not necessary, and they say F it. But the students adopted that and ran with it and said, F it won't cut it. So you've got to think about it differently. You've got to do it better. So I'll throw that out there just as a place to start. I want to share with you breaking news. This came out just about a half an hour ago. So when we think about progress with the vaccine, sometimes it's 2 steps up and 1 step back. Instead of 480,000 doses, the state now expects to receive 370. And I'm not sure why. I'm sure someone knows, but that's, these numbers will change up or down. We adjust accordingly. We still have the same priorities. We're still working through that as we have indicated. And I'll share also by way of information, as we talk about New River, the Montgomery County Chamber of Commerce had their 2020 awards program recently. And I want to point out for you that the New River Task Force received the Regional Impact Award. The Montgomery County Health Department was the Outstanding Community Service Organization. And then further down, some of our other colleagues with the town and other agencies locally were recognized as well. So that's exciting stuff. Now on to the work of the task force. The website that is used for this is nrvroadtowellness.com, and it's run by the Regional Commission. I'll go through this pretty quickly because I think some of you are already pretty familiar with this. If we look here, we see under the About link, there's a little bit of history, but the task force meets 3 times a week, publishes an update each of those days. Monday, Wednesday, Friday is the normal schedule. And I want to share with you what's in that update. It goes out as an email. It's published to the website, as you saw. It goes out as an email with a number of attachments. And I want to walk through one just so you see what it contains for those that might not have seen this yet. Updates, what's new, fast facts, testing schedules, vaccine schedules, updates for guidance, social media, website updates, the governor's advice as it changes, resources available from a business continuity group that's associated with the task force, isolation and quarantine, and then prevention messages. So we're working on better organizing this visually, perhaps compartmentalizing some of the information better. But this is what it looks like for now. And then at the bottom, we have a data table with new cases, the 7-day average, and it's all broken out by locality, and then totals. Those are cumulative. So those 3 columns on the right will always go up. The other 2 go up and hopefully eventually down. The Regional Commission also publishes some of the same information in a dashboard. It's updated again 3 times a week, and this is for the entire New River Valley, the 5 municipalities, 4 counties and 1 city. Dr. Bissell also does a weekly update with the press. This is an interactive, moderated Zoom platform. And in that, she has a script that she prepares. There are epi curves that are shared so we can show how the data is changing up or down across different age groups and across different localities. And she solicits questions through the portal on the website and also by email. We collect those each week. And that's used to develop the script that she uses to brief the press, and then she takes questions each week. That runs about a half an hour. And Jen Harris from Montgomery County and Durley and the crew there at Montgomery County do a good job of producing that each week. We also provide information on various public events. This is a community conversation series that just concluded last night. There's a mobile food pantry event that's occurring today that the task force is involved in. So you see the variety of pieces of information that are shared with that. Kristen and Samara and some others there in the Roanoke area, so others on this call receive that document each time it comes out. I would encourage them and all of you to share it with your partners, others that would be interested in that information. Let me come back to the website for a minute and show you a couple of other things. The campaign up here is called Be Committed, Be Well. It was developed earlier this year with some creative work by Virginia Tech and other partners. And there are a number of tools that are on the website here. The community wellness commitment here and all the different sponsors you see there that were involved. There are a series of proclamations and resolutions that were passed by local governments and others. And then a number of videos and announcements and downloadable resources that can be customized by locality or place of business or place of worship, and then used in their environment and various templates as well. So we've got masks, we've got pins that we use during election season. We've got lots of resources that are available out of that campaign. And as they are online, they are also available to you. The business continuity team is a small group of experts that work with businesses that have had or are worried about COVID cases and outbreaks. They also work with school systems. They have funding to provide public relations services, outbreak mitigation services, response services, even facility cleaning. So we're working with our business community in the NRV on these fronts and trying to push that tool out so that we can provide support to that community. This link simply shows the COVID dashboard that we include in the update. And then finally, here's the Q&A with Dr. Bissell. This is our online portal for receiving questions. Excuse me, go a little slower. So optional name, and then this is the most recent update from the 14th from this week. So that's the website for the local task force. As I said, weekly press briefing 3 times a week, meetings 3 times a week, updates, including the dashboard and other announcements. And then that's reflected on the website. The Virginia Department of Health, very excited with the work that Todd and his group is doing, and the new dashboard, which you have seen. I want to show you where we answer a lot of questions that come in to us here. We have a data portal. And again, many of you have seen this. There's a daily dashboard that has statewide information. There is also local information under the outbreaks tab and under the locality tab. So we use this a lot when people are saying, what's the number for Floyd County? What's the number for Roanoke County? We have those here by locality, city and county, and it's a searchable list. Over here, you can search cases. You can also get hospitalizations and deaths. So you can do a customizable search for various data. We also have an outbreaks tab, and we publish information for long-term care facilities specifically, and also for school divisions that are experiencing outbreaks. So that is a very useful tool. The vaccine website, Todd showed you, we're very excited about that as well, particularly the large library of FAQs. And as Todd said, the frequency with which that is updated, this will become more and more useful to us as time goes by. Here's the FAQ list is quite long. So that's where that is. I am told there are statewide, let me show you this. All right, this just goes on and on and on. Development and safety, vaccine distribution, and you see we're just halfway through there. So lots and lots and lots of information there. That's going to be very useful. I'm told there is a couple of statewide news releases under development, probably will come out next week. There's one for the vaccine data dashboard, which is this site that we're looking at here. There is another under development for another dashboard that will describe outbreaks by selected exposure settings. And I'm not certain exactly what that means, but look forward to that. Obviously, the state has a commitment to transparency, and often these things are published without myself or my colleagues having prior knowledge. That's okay, because we would rather have the tool and not know in advance than be briefed in advance but not have the tool. So we try to keep our priorities straight there. But these things are obviously continuing to develop very rapidly, and I think will continue to do so. Todd mentioned the satellite media tour that the commissioner is conducting today. And on December 30th at 11, there's a press briefing on vaccine plan and response. It's for members of the press only as it's live, but the recording and the transcript will be available afterwards. And Kristen, I believe you have that in the slides, which we'll come back to in just a second. Finally, there is another group that we're networking with called Hadaway Communications. And they have a conference, a Zoom. It happens every couple of weeks, I believe. This is their website. They are a strategic communications group like Sidal and Vance. They do a lot of aspirational and inspirational work with a number of clients. They conduct a very interesting Zoom session, which I want to share the information for the next one with the folks there in Roanoke that they can share more broadly. But they're providing the same kind of strategic thinking that many of us are doing, and also providing some tools. And this is a group out of, I'm not even sure where they're located. They have clients all over the world, and the people on the call or people that are invited to the call come from all over the United States. But they have some holiday posts here that feature turkeys, which I told them was especially appropriate for us here in Southwest Virginia. So we'll make sure that you have these available to you as well. And I invite you to participate in those calls if you have the opportunity. We'll continue to share the information on that availability. So that's Hadaway. I believe I will stop sharing there. I have a couple of, here I go, stop sharing. And then finally, well, there is one other that Kristen, you may have in the can we drop down a couple of slides? You have the Attorney General's information. That was something else that came out just recently. The Attorney General's office in Virginia made an announcement recently about scams related to COVID. So we wanted to ask your help in pushing that announcement out. And I can get a link to that for you. I may not have provided that for the slides. Finally, a couple of points on the vaccination. We need everyone to be ambassadors for the vaccination, and encourage people to get it when it's available. That's a tricky balancing act because obviously it's not available to most of us now. But we want people to be motivated to take advantage of it when it is available, and recognize that while we do have a light at the end of the tunnel is still fairly long for most of us. There are common questions, concerns about the vaccine making me sick. We see that all the time with all types of vaccinations. The fact is this vaccination doesn't contain anything that will make you sick. There's no live virus, there's no killed virus, there's no virus at all. So it stimulates your immune system. You might feel a little droopy for a day or two, but that is an indication your immune system is working. So does the vaccine make me sick? No. The other question people have is, does the vaccine prevent me from making other people sick? Does it prevent me from being infectious? And the answer to that is we don't know. And that means you shouldn't assume that it does. So we all still have to be careful. Even those that are vaccinated still need to remember to practice the precautions. So we encourage everyone to model that good behavior, because if it won't cut it, get the vaccine as soon as it's available to you, and we'll continue to provide the, receive the information, share the information, and stay in touch with you on all of these as we go forward. So I'll stop there. Thank you.
Hey, Bobby, this is Pam. Can you just mention a little bit about the task force and the Planning Commission and Holly Lesko and her position and what she's doing for our school systems? Yeah,
Holly is part of that business continuity group that provides services to businesses and schools. They're helping them, and Pam, you may be able to articulate this better, but helping businesses and schools prepare for, prevent, and react to cases and outbreaks in their environments. One of the things the school systems in New River are doing, most of them are registering teachers and staff and others that might ultimately wish to receive the vaccine, so that when it is available to those populations, they stand ready to immediately know who to go to make that available and put that to work. Was there anything else, Pam?
I would just express our gratitude to both Ashley and Holly, because as we're working through cases, if we get one that's directly related to a business, we don't have to spend an hour talking to the employer and the employees. We can turf it over to Ashley to jump in, and she's well qualified to be able to address their concerns. And the same thing with Holly Lesko. She's become the liaison between the task force, the health department, and the school system. So she can answer all of those questions that come up repeatedly about what does it look like to get a school back up and running? What is it going to take if we have to shut a classroom down? So they have actually taken a lot of the burden off of our backs as epidemiologists and community health outreach folks, and it really makes a difference. So we're very grateful for that position. And if you all have those kind of resources available to you in your areas, I'd highly recommend that you look into getting them, because it does make a difference in your workload.
Thank you so much, Pam and Bobby. We have about 10 minutes left. So if we can capture questions for them in the chat box, we will get them rerouted and answers back out to everybody as a follow-up email. I just did want to clarify the New River Task Force that Bobby just presented on. They do have some very nice resources, the website. And I wanted a moment to share those with this group, even though they do cover the NRV and not Roanoke City, Allegheny, because it has been a regional effort. And a lot of the folks on this call have been very active with Bobby and Pam and Dr. Bissell and that team. And we just want to appreciate and also acknowledge that work. And also clarify that that has been going on for some time, in addition to what we're trying to do now. And again, there's efforts at all levels. We appreciate what the state is doing. We appreciate what you all are doing at your locality and organization level. One of the things Dr. Adele always says is, the pandemic has a lot of little local epi curves. There's a lot of little outbreaks in various communities, families, organizations, and the same is true for communications. It's got to happen at every level. And so we appreciate what the New River Task Force has accomplished in those examples. What we'd like to do with the time that we have left is introduce, rather than go through all the questions that we had for us to discuss, is kind of target and focus our time on a key outcome that we wanted to accomplish today. And that is this idea that we'd like to start gathering the outreach sort of strategies, mechanisms, the specific tools that you all have at your disposal that we know that we can leverage. And what we'd like to do is get these over the next week or so. And I know that that's the holiday season. So if you have time to do that before you get out of the office, but if we can come back together in January in the new year and look at all this information, if we can all input it into this spreadsheet, then we can start to identify the gaps. So we have a spreadsheet. We'll send out a link to everyone so that you can edit this. But we'd ask that you plug in your personal name, the organization you're representing, the resources, the specific outreach channels that you have access to, whether it be a social media page, whether it be a TV station, whether it be an email listserv, everything that you have at your disposal that you could use to push these messages that we've talked about today, that Todd presented, that the state is developing, that Bobby shared us, anything, an official channel that you have to push it. And that will help us start to understand, if we can look at it all in one place next month, we'll start to identify who are we missing, those vulnerable populations. And I know we started that conversation at our meeting right after Thanksgiving. So we will leverage those conversations with this spreadsheet and ensure that we are reaching as far and wide as we can. So as you can see, the example that we've put in there are the Facebook page of the Roanoke City Allegheny Health District and our partner email listserv. We will certainly plan to push the VDH materials through our channels. And then we may be, of course, creating some content specific to our health district, like pushing out our numbers, etc. And we try to identify who our key audience is. So for some of you, it may be school parents. For some of you, it may be residents of your locality, folks who use your services, whatever it may be. Help us understand who we're reaching when you reach out through those channels. And then this idea that came out very clearly from our last meeting after Thanksgiving was the idea that some sharing of local stories would be very powerful and a really good place maybe for this group to spend our time, since we are going to have these great messages coming out from our national and state resources. But the local stories is still a place that we identified in our last meeting to focus. And what we're asking is, can you help us solicit those stories? So you can answer yes or no there. And then we also need help in that last column, identifying how we might be able to turn those stories into something that we can share, the process of making videos, creating graphics, etc. So please be on the lookout from me for a link to this survey. I was going to spend some time getting some examples, but I think we can save that time. And if you all could please fill that out with any channel that you have that you can be pushing the messages that we talked about and to whom those messages will go. And again, we'll start to figure out who are we missing once we see it all in one place. So what I'd like to do now is turn it over to Tiffany at the City of Roanoke and Amy at the county and see if they can help us identify what our next steps should be moving forward. And of course, we'll come back to this spreadsheet, but what else is needed based on what you've heard today and what we want to do with that message with the powers that be gathered at this table. So thank you so much to Tiffany again for hosting us. And to Amy, who's been very helpful with getting the message out on behalf of Dr. Morrow. So Tiffany and Amy.
Sure. So thank you guys. This was a ton of great information. And what we've been trying to do in the city, of course, I'll pass it off to Amy too, but we kind of as a region, because you've got Roanoke City, Roanoke County, Salem, kind of Botetourt in that area. I know today in the city, we're going to actually be recording a Zoom call that is going to have our mayor, our vice mayor, and Dr. Morrow on it, as well as Katie Hedrick out of my office, who's our Spanish. She's our COVID bilingual support specialist. And we are going to actually have that and be able to push it out with just kind of some high level of, the vaccine's coming. These are some things. And then we're also working with our local hospital partners with Chris Turnbull and his team to be able to kind of see where we need to go, because I loved what you presented, just with those focus groups, and especially with our Black and Brown communities, making sure that we're answering questions, we're giving people the facts. So we did push out the things that were talked about today, the flyers. We put those into a JPEG format and we pushed them out on social media this morning. So we feel like, as long as we're peppering it with the consistent messaging, hopefully we're going to be able to give folks the right info. But that's some of the things we're going to try to come up with our influencers that are getting the vaccine and be able to kind of leverage that as well. And Amy, did you have anything?
Yeah, we're doing some things here in the county too. I think from a broader perspective for everybody here, I think that the PIO resource sheet that Kristen just shared, I think that's going to be really important, so we can all see how we're able to push out the information. Everybody's got a bunch of different audiences. Tiffany and I have citizens, hospitals are going to have patients. And so I think we just have to look at all those different opportunities and jump on them and push it out there. And what are those stories? Who are the individuals who can talk about, did they get the vaccine? Are they going to get the vaccine? The importance of it. I think those are really good messages. So I'm excited to see what everybody has planned and see if we can really push this out more. So, and great job to Kristen and Samara for and everybody else who's been coming up with all these materials and all the information. I think it's great to be able to give that to everybody on this call and others to push it out. So it's real exciting.
And I echo that too with Kristen and Samira. Oh my gosh, the stuff, because what we want to do is we want to take the health department's graphics and we just want to put them out there. We want to elevate it. So, we don't need to recreate the wheel. So we want to keep that consistent message. So you guys have been rock stars. And I know sometimes PIO work is not your forte, but you guys are doing a great job at it.
Yeah. Agreed.
It really isn't. And I think that's why Samira, myself, the New River Health District staff as well, we're so excited, because if we can partner the public health information with the expertise of the PIOs, I think that will just be such a tremendous outcome for our community. So we were so excited on the response to our initial meeting and today. And again, we do want to make this an action-oriented group. And so we will very much do all we can to pull everything together for this team. And again, thanks to Todd at the state and all the partners who are working on this, because this will be a game changer for our communities. And so please look out for a date for a January meeting and the link to the survey, and if you can, or the link to that spreadsheet. And so folks can plug that in. We will caught a few questions in the chat box. We'll try to get answers for and email out as well. So thanks so much to everybody. Enjoy the weather and the holidays, and we'll see you in the new year.
Bye, everybody.
Bye.
Bye.